Hello, everyone, and thank you so much for joining us today for this wonderful MeWe seminar. As it's wonderful to see you all, always a pleasure. I hope that the fall is treating you okay. We're in a real exciting time in history. That's always fun. But that's all I have to say about that. So it is my absolute pleasure to introduce or reintroduce, for those of you who already know, two wonderful MeWe alumni peer mentors, Dr. Kaleea Lewis and Dr. Charlotte Farewell, who are going to be sharing with you some of their experience and around doing community-based participatory research methods as a approach to research, as a set of principles for research. I'm really looking forward to hearing what they have to say. And with that, I will turn it over to them. Thank you so much.
Right. So we'll get started. So my name is Kaleea and Charlotte is here also. And so today we'll be talking about community-based participatory research. Okay, so thinking about the really kind of fundamental definition of CBPR is just community-based research or participatory research. And that's a really important kind of part to hinge on. The participatory element in public health really focuses on the social, structural, and physical environmental inequities through active involvement of community members, organizational representatives, and researchers in all aspects of the research process. And so today, as we talk about CBPR, really hinging upon that participatory aspect to really kind of illustrate how we can engage with this method, with the also kind of the conflicts that may arise as a way to really problematize and also reconceptualize how we are engaging with particularly marginalized communities given the state of the social world we live in today. And so when we think of CBPR as an approach to research, we can really think about it as an effective way to kind of change and involve and improve community health and well-being. So within this slide, we also have just some of those major principles. So for example, accessing community strengths and dynamics, identifying priority public health issues and research questions and designing. And so to really kind of hinge upon this is to illustrate that it's not a specific method or research design. It is more so of how do we engage with these elements that allow us to really transform how we think about these core elements of public health to really ensure that we are producing these equitable environments. And so CBPR studies can involve both qualitative and quantitative methods, whichever is your fancy. And so more so of thinking about how we think about these principles or these approaches to research when really engaging with CBPR, that end ultimate goal is that sharing of power or that transferring of power from ourselves, thinking of as the researchers to the community. It is more so of not of what we want to do with the community. How do we approach research, particularly thinking that we always have this kind of grand idea or scheme? How do we approach it in a way that allows that transference of power to ensure that the community is actually getting what they need, particularly as it relates to really dismantling a lot of these inequities? And so we'll spend a lot of time kind of providing personal examples of how we think through this approach to research and some of the struggles we've had and how we overcome some of those obstacles. And so when thinking about the CBPR goals, and so one of the core goals is to enhance community capacity by supporting equal community participation in research for which they will directly benefit. And I know that sounds like a mouthful, and in practice or just reading it is really easy, but when we are actually in the community, what we want to really spend a lot of time on is really talking about how to do that. Specifically, if you have, for example, the tenure clock kind of ticking in your ear with the kind of core understanding that community-based participatory research takes a lot of time. And so when we think of those goals, it's also to establish sustainable programs that improve health behaviors and health outcomes in populations experiencing health disparities. And so even with that understanding that X community is undergoing or experiencing high rates of hypertension, high rates of diabetes, even if we, for example, have that grant to do CBPR-based work in X community as it relates to lowering rates of diabetes, one of those kind of major tensions of CBPR is to understand, even with their acknowledgement that, for example, diabetes may be rampant in the community, if that is not something that they see in the forefront as a major issue, how do we really think through engaging in equitable CBPR goals and really ensuring that the community is getting what they want? And so really, what I really like about CBPR is it really forces researchers to be kind of understanding and or counter the ways in which we can be exploitive of certain communities. And so the last goal is to really think through and accelerate the translation of research findings to communities experiencing health disparities by designing these effective and culturally tailored interventions. And I'll probably say there's too much, but really thinking through that transference of power, that's how you accelerate that translation of research findings, particularly as it relates to how do you think from the beginning of the project to the end of the project to implement community members in all aspects of that power. How do you, as the researcher, also take a step back to understand that even with that transference of power, it may be a struggle? And so how do you think through these things with the kind of tumultuous time we're going through to really ensure that we are thinking through and enhancing those core principles of not even CBPR, but of public health, which is to dismantle inequities such as structural racism, discrimination, and all of those other interlocking forms of oppression. Okay, so lastly, we have what makes, for my section, what makes CBPR different than traditional research. And so traditional research, you can have this in quotations. You can think of community as a passive subject of study. You can think of research design done from an a priori by an institution. So really coming in to tell that community what needs to be done. You can think of the traditional needs assessments, data collection, implementation, and evaluation, particularly thinking from academic institutions' responsibility. And also for that traditional research, you can think of the sustainability plan that's not really concluded. So for example, I go into that community, I collect my data, I analyze the data, I write the papers, and then I'm gone. And so CBPR is in direct tension with that, particularly thinking about not only getting those deliverables, which are really important to our career, but also thinking through how do we implement transformative structural change. And so CBPR really involves the community being studied in the research. And particularly, I want to hone in on being studied in the research, more so of involving the community as it relates to those core outcomes of the research. And so not necessarily them being studied, but them being an integral part of what is being evaluated, an integral part of the change that will hopefully come from the CBPR focused research. We can also think of the research design really done with representatives from the community and the academic institution. And so really thinking of these partnerships or relationships that they are cyclical, and thinking through that there will be some type of transference of thinking through how we engage in conflict resolution as it relates to these really big ticket goals that we have with the research versus what is actually appropriate for the community. We can also think of reevaluating or reconceptualizing a needs assessment, data collection, implementation, and evaluation as everyone's responsibility, not simply me as ex-researcher going in, collecting data, telling you what needs to be done. It's more so, again, of how do we involve that community in every aspect of the research project. And lastly, thinking about sustainability is a priority that begins at the program's inception. And so thinking through how do you maintain these year-long, multi-year-long relationships? And also how do you do that with the tenure requirements, the requirements of your institution, and also your requirements and your duties to those communities that you're helping?
Thanks, Kaleea. I'm going to jump in and just provide first sort of a high level overview of the key principles of CBPR, but then Kaleea and I felt like it'd be most impactful to actually have some applied examples of how we've integrated these key principles into our work. So we're each going to talk about a case study and how we've identified and focused on some of these principles. So these are kind of the core 8 key principles of CBPR. Kaleea did a really wonderful job of touching on some of these already. And again, we'll kind of emphasize them more through practical application. But one of the most important kind of first key principles is recognizing the community as a unit of identity. And I'll give an example of what I mean by that, but acknowledging that each community is unique, and it's important to understand how community is defined in your work. And there's lots of different ways of defining that. Building on strengths and resources within the community. This is a really big one. We focus on this a lot in our work. So often we conduct these community needs assessments, which are really important to understand the needs of a community, the risk factors within communities. But particularly when working in underrepresented communities, it's incredibly important to identify the strengths and resources that inherently already exist, and then to be able to further cultivate and provide more supports to amplify those strengths. Collaborative relationships is a key principle of CBPR throughout all aspects and all phases of the research process, as Kaleea alluded to, really fostering collaboration from conceptualization of your project through culmination of the project. Integrating knowledge and action to ensure that there is mutual benefit for all partners. So of course, from our perspective as researchers, and again, as faculty, we want to support the community, and we also have a job we want to keep. And so we want to make sure that the process is going to be beneficial for us, but also similarly that it's beneficial for the community, and really aligning with what they've identified as their main needs are. Co-learning and empowerment, again, we talked a little bit about, but translating kind of that power to the community and having them really drive the research. And this process often and always, I'd say, is a cyclical process and an incremental process. So it needs to be iterative. We need to be coming back to the community, coming back to our steering committee, our advisory board, whatever we're calling our entity, where we bring academics, community members together to really think through what's happening in the research. How do we adapt what we're doing to make sure that we are the outcome is that mutual benefit. And this is a very slow process, and we'll talk about some of the ways to navigate that. And then addressing health from both positive and ecological perspectives. So, this is sort of commonplace in public health, but really thinking about how organizational and structural factors are shaping the health outcome that we're focusing on, and the need to involve community members at various levels to ensure that we're maximally impactful. And then the dissemination piece of CBPR is critical. So disseminating data regularly throughout the process, throughout all phases of the research, and ensuring, again, the community is receiving the data and information that's going to be most valuable for them to inform their future work. Slide. So you can jump to the next one, Kaleea, thank you. So I'm going to start by just talking about a case study or a project that I'm currently involved in. So this project is called Wellbeing of the Early Education Workforce in Low Resource Locations. And I developed this project with my colleague, Jenny Puma, and we're at the University of Colorado. And we just as a little bit of history, we've worked with the early childhood education community for about 15 years. And we primarily, starting out right after my master's degree, I did a lot of work in early childhood obesity prevention. And so we did some collaboration with Head Start partners in Colorado. And Head Start partners, for those of you who don't know the EC world, Head Start is a federally funded program that provides care for kiddos age 0 to 5, subsidized care for the most vulnerable families in the states. And so it's a really important program, and it funds a huge millions of children in the country receive care through Head Start. So we have been collaborating with them for a long, long time to do this early childhood obesity work. And we were out in the field and really engaging with them to understand, how we can promote healthy eating and physical activity of these kiddos. And we heard over and over again from the teachers we were working with and the leaders and the staff that they just didn't have capacity to be implementing curriculum during mealtime, for example, or to be integrating these, short 5-10 minute activities into the school day. They just were so overwhelmed already. It wasn't going to work. And so Ginny and I heard that, and we thought, well, we need to pivot, because this is not going to be an effective intervention if the community isn't bought in and don't see this as their high priority need, and the teachers are the ones that are super burned out. So we took a step back and engaged in a couple-year process of working with the steering committee, doing lots and lots of formative work to really understand, well, what are the main needs related to this community? And we kept coming back to the mental health and well-being of the teachers. I mean, if you know this community or have read anything about EC staff, they experience incredibly high rates of health and physical health and mental health disparities. For example, attrition rates among this workforce are about 60% annually. So it is a workforce with incredibly high levels of burnout. So we decided we need to work with this community to develop programs that support the well-being of staff, because if we don't do that, we're not going to be able to do anything to support that quality of care and these child outcomes that we were initially looking at. So we worked with this steering committee, and I'll give examples again of these principles, but we designed this program, and we've sort of gone through iterations of funding, and right now we're in a 5-year funding period through the Administration for Children and Families. And it's a multi-level program that we are implementing in 5 of the largest Head Start agencies throughout Colorado. And the outcomes are really primarily to improve the well-being of the staff. And we hypothesize that by improving the well-being, this will decrease turnover and burnout of this population, thus improving the quality of caregiver-child interactions and child outcomes. So again, really pivoting our focus to the adults who are caring for these incredibly vulnerable children during very, very sensitive periods of time. And you can see sort of I'm not going to go through well in any great detail, happy to connect offline if you do work in this area, but we kind of formed our program around these 4 key areas that again was based on a lot of strengths and needs assessments from the community, our steering committee, and formative work. And then we have these multi-level activities that are integrated throughout the school day to promote the well-being of staff. This slide. And this is our conceptual model. So just, I want to highlight the most important thing here is not really specifically the activities we're providing at each level, but more the multi-level approach. So this is, a key aspect of public health, certainly. And at CBPR, as you remember, one of the principles we talked about was really taking ecological perspectives to understand what needs to be supported at different levels of influence to yield health benefits. And so our program is intentionally developed to target individual level supports, interpersonal level supports, like teacher-peer connection, and organizational level supports. The really big focus on cultivating, shaping a health promoting environment within the workplace to support teacher well-being. Slide. So I'm just going to highlight 3 key principles. We really work to target all of the key principles, but I'm going to target 3 and describe really how we apply these principles to this work. So the first, considering multiple levels of community, if you remember, that was the first one that I highlighted. So this map on the right shows Colorado. If you're unfamiliar with our state, sort of a big rectangle. And this program is implemented in 3 different parts of Colorado. So this top red circle is a very urban area. This is where Denver's located, Denver and the suburbs, pretty urban environments. And then these 2 red circles down here are 2 of the rural areas of the state. So on the left is the San Luis Valley, which is the lowest resourced area of our state. The San Luis Valley is comprised of 6 counties where a majority of folks are living in poverty. And then on the right here is Southeast Colorado, the plains of Colorado, big agricultural production area, and an area that's very low resource and doesn't often receive supports because they're kind of off the grid. They're, for example, just to give context, it's about 4 to 5 hours from Denver to get down here. So we've done a lot of work with Denver and a lot of work with San Luis Valley in the past, but we hadn't worked with Southeast Colorado. And so we started by really going down to these areas, spending a lot of time in community and doing interviews and meeting with folks and just learning about their community, learning about the strengths in their community, what's going well, what would they like to see more support related to. And in terms of identifying the unit of community, recognize that there are these Head Start agencies, which are big agencies, but within those, there are actually multiple kind of school sites or EC centers. So for example, one of our largest Head Start centers has 24 centers embedded within it. And those centers are spread out geographically. They're culturally different and culturally unique. So it was very important that we meet with the Head Start agency, but really understand the differences within these schools and school systems. And then they're all located within different towns. And there's a lot of cultural diversity happening in these towns. So we had to do, extensive work to really understand what we mean by unit of identity, the community as a unit of identity, and how we develop this program to be supportive for different communities. We did 40 interviews with different leaders, basically lots of different folks involved in the Head Start community, teachers, staff, parents, et cetera, to inform the development of this project. And then we really just got to know the community. So we held all these fun events. This one right here is we had a kind of self-care event in the park down the San Luis Valley, and we had a yoga instructor come and masseuse come and a woman come and paint nails. And we just it was just casual, it was food, just to get to know folks and again, chat with them. And so we had one Head Start teacher who said, out here in the middle of nowhere, we tend to get forgotten. And so I think it's cool that you guys make it a point, to come to the centers. It made me feel good that you guys take the time to actually come out and talk to us, not always just on the computer, So this was, this program was funded right after COVID. So there's a real need for connection to support these communities. Next slide. Next, related to the second principle of building on strengths. So we really focused on doing a comprehensive strengths assessment. Again, we did assess needs, but we really, during our interviews especially, we asked, what do you love about living in your community? What are the highlights for you? What do you do to support your well-being? What helps you handle stressors? And taking that strengths-based perspective, we not only received really valuable feedback, but we were able to identify how we could really build off of those strengths and further enhance those strengths in communities. So we tapped into lots of existing teams and events and identified leaders within each setting that were really integral to supporting this work. So for example, down here, I love this picture of, this is a dance party we were having. We worked with one of the early childhood councils in the San Luis Valley, and they cited that they just felt like, again, after COVID, their community was super disconnected, and just there's a lot of issues from that, a lot of isolation. And so we helped them plan this community connection event. Really, again, the only goal was to bring people together. And we had music and food. And this guy right in the middle is the mayor of Alamosa, which is the biggest county down the San Luis Valley. So he showed up, surprising all of us. And it just highlights, how important this man was incredibly important to, and is incredibly important to the implementation of our program and success of our program, because he's really, seen as a really important part of this community and an important advocate. So, and he danced the whole night with us, which is really cool. And then the other thing I'll point out just in these visuals, we also identified lots of different community wellness events that were already happening. And so we set up booths at lots of events, again, just to kind of get the word out about the program and just provide supports for community members targeting, those families with young kiddos. Slide. And then finally, before I pass it back to Kaleea to talk about her case study, the last principle I'll highlight is number 3, so facilitating collaborative, equitable partnerships in all phases. So I talked a little bit about the formative work we did, and as part of that, in all of our work, we have steering committees. And in this case, our steering committee is comprised of Head Start agency leaders, teachers, leaders within specific centers, parents, paras. We even have a cook on one of our committees and a janitor on another. So a very interdisciplinary team. And that team, we meet monthly. We've met monthly for years and years. And, people come and go, of course, but we've retained the committee. And they really inform from the conceptualization of the project through the development, now through the implementation and evaluation. Every month, we bring them findings from our level or from our perspective, and then they share with us what's happening in their communities, and we work to make adaptations or just discuss what needs to happen, to ensure that we're being really supportive of these communities. And then a big piece of this, as I mentioned, is disseminating findings. So you can see here on the right, this is an example. We have lots and lots of data. We administer, just because of our study design, we administer pre-post surveys for 5 years, and then we do a lot of qualitative work. And so this is just one of our agencies. We developed these one-pagers, and we do every year, that are agency specific and just highlight the data from their survey. So this highlights, the different domains we evaluate, and kind of the key pieces that we heard that are, most important to them, and that kind of stood out to us as researchers. And this is just one page. This is a much longer document, but it's a way of sharing the data back with them in a visually appealing way. So they then use that for their subsequent grants, and acquiring more funding, and for the reporting they have to do for their federal funds. And so one Head Start teacher said, I think the WELL program gets us a little more engaged and active, and gets us a little bit more involved, like mentally and socially involved in it. The other programs, they just kind of tell us what we need to do or what we can do, and then just leave it at that. So again, I think this quote beautifully captures CBPR and why CBR is so effective, because folks really have buy-in from the beginning and they are informing the development of the program from the get-go. So it really yields, maximum impact and ensures that we are achieving that mutual benefit for everyone involved. So I think that was my last slide for now, and I'll hand it back to Kaleea until I take it back to close.
All right. And so now I want to talk about an intersectional examination of race-based traumatic stress. So exploring the lived experiences of Black emerging adults. And so this was what I like to jokingly refer to as my first big girl project. And so off the cusp of not only COVID, but my postdoc, I really engaged or thought of this project as the first time that I could come into my own as a researcher. And so I knew from the start that I wanted to implement what I assumed to be the most radical CBPR-based principles ever. And so what I want to talk through is some of those obstacles and how I even had to renegotiate and understand how even through some of the alignment of those principles, I was still approaching the community from a deficit standpoint. And so really the cusp of this, or really the goal of this research, was to really understand what race-based traumatic stress meant in the lives of Black emerging adults living in St. Louis County and St. Louis City. And so we know race-based traumatic stress, like other forms of racism, can pose a significant mental health for Black emerging adults. So thinking of between 18 and 27 years. And so also looking at a lot of the extant literature, Black emerging adults in comparison to other emerging adults of color are least likely to engage in professional mental health services. And so really thinking through this, their underutilization of mental health services not only affects their quality of life within that specific time point, but also places them at greater risk or odds of being persistently ill once diagnosed in later life. And so I knew that there was a small body of work that really studied the mental health impact of race-based traumatic stress, the majority of that being scale or survey development efforts. And so I was really excited once this grant got funded to really dive into and explore and also strengthen my understanding of qualitative CBPR and really diving into a community that I wrongfully assumed would be all open. And I just thought that this would be an easy project because I've been working, really implementing a lot of these topics, studying it, engaging in these kind of core constructs for years. And so I'd assumed that it would be just easy run of the mill. And so the study aim was to really expand current knowledge using qualitative methods to explore the pathways through which race-based traumatic stress manifests and adversely impacts the mental health of Black emerging adults. And so the first CBPR principle that really shook me was really recognizing the community as a unit of identity and thinking through, for me, the complexity of both difference and distance. And so when thinking of that, I live in Columbia, Missouri, which is located in Boone County, and wanted to really engage with Black emerging adults living in both St. Louis County and St. Louis City. That is on a good day, maybe without traffic, 2 hours away. And so really thinking through that first level of complexity, not only distance, thinking through both the cultural differences that are located in Boone and in St. Louis County and St. Louis City, but also understanding that I am for lack of good or bad, a Southerner at heart. And so even before getting a job at the University of Missouri, I just assumed Missouri was a simple flyover state. And so moving there really thrust me into the really complex, really tension-filled history that Missouri has, particularly as it relates to racial equity and their entrenchment in a lot of these forms of oppression. And so again, me, a bushy-eyed, naive assistant professor, was going to go into St. Louis and research, which is excellent in theory, but this is coming off the cusp of Mike Brown. This is coming off the cusp of St. Louis, this is coming off the cusp of, if you know anything about St. Louis, there is a very rich history of overt racial oppression. And so regardless of whether or not there was racial concordance with the communities I wanted to serve, there were a lot of slam doors, rightfully so, because yet another researcher was coming in to exploit, to take, extract, to learn more, even if they did have positive thoughts or earnest thoughts about what they wanted to do. It's just yet another person coming to tell me, as a St. Louis resident, that I am inept, that I do not engage in X, Y, and Z, and that I need to be fixed. And so when thinking about that, it took not too long for me to understand why the doors were being closed. Not too long to understand why they viewed me in a certain way. So regardless of the credentials that may come from, hi, I'm a researcher at the University of Missouri, there were still a lot of hesitancy as it relates to being an outsider on multiple kind of levels, and understanding that, okay, you don't even live in St. Louis, so you don't know about what it feels like to live as a Black person in St. Louis. I know what it feels like to live as a Black person in Columbia, Missouri. And so those are two different things. And so really thinking through the CBPR principle of recognizing the community as a unit of identity is more so of really helping you think as a researcher, what do you do when you face those complexities of both difference and distance? Also thinking through this principle, recognizing the community as a unit of identity, is working with gatekeepers. And so when understanding that, why it was a little tough, because number one, they don't know me. I am not engaged in any of the grassroots communities that are very deeply entrenched in Black unity and just Black empowerment in St. Louis. And so I thought through, sat with mentors who advised me to engage with MU Extension. And so MU Extension are just these extension sites located across the state. And so they have a few in St. Louis County and St. Louis City. And so their goal is to really ensure or to really help me recruit a community sample of Black emerging adults who are not affiliated with the larger university system, and to help me provide a private physical space for both the digital storytelling and the other aspects. And again, while you can read all the beautiful statements about MU Extension and what they do and how deeply they are involved in the community, I did find that there were even gatekeepers who were weary of me. And so again, recognizing the community as a unit of identity, what does it mean when you work with or try to engage with the community through a different aspect and still receiving some closed doors? And that was a little difficult for me to deal with without sitting back and thinking. Particularly the person that I wanted to work with was very frank and explained to me, regardless of whether or not you look like the people you want to serve, we have been hurt by people who look like you, by people who do not look like you, from your institution and from institutions nationwide. And so it's going to be really tough to get into the community, to work with them, to engage with them, and even to get this interview, which added a lot of time that it took to get this study off the ground. But I can honestly say I've never been more thankful for the no's that I got in the beginning to really help me think through and really decolonize how I think about CBPR. Also thinking about how CBPR facilitates co-learning and capacity building among all partners. And so particularly when thinking about this, I'm thinking of data collection expectations versus reality. So again, I was ready to go in February. I maybe got my first interview in August. So to say it took a while was an understatement. And so I assumed, again, fresh-eyed, bushy-tailed, okay, I'm going to do interviews. I did interviews during my dissertation. It was easy. I've done interviews as a postdoc. It was easy. I've done interviews with other colleagues, and it was easy. Why is this so hard for me? And so thinking through just the data collection expectations versus reality, and understanding not only within the facet of time, but also within the facet of once I started to collect the data and once I started to get the interviews rolling, they were in complete left field of not only what I was expecting, but also of how they responded, how they thought of a lot of the questions. So for example, there were a series of questions about what it feels like to live in St. Louis, Missouri. And so of course, naive, thinking through, not with the mindset of someone who simply, I just understand history. I've read the history, but I have not lived the history. And so there were a lot of conversations about exploitation. There were a lot of conversations about disenfranchisement, about gentrification, and about all these things which not overtly relate to, for example, race-based traumatic stress, but are the pathways through which race-based traumatic stress really manifests in their life. And so it took me a second to really even sit back and think, well, even you as a researcher are conceptualizing these things within a really deficit standpoint, with understanding that, yes, they may not engage in these mental health, professional mental health services. That is because every other day they are being disenfranchised or they're being dislocated. And so really thinking about how to think through a lot of these core concepts with thinking about data collection expectations versus reality. With the understanding, I know that qualitative research takes a long time, but the reality of it, if I really wanted to do, which I wanted to do, true community-based participatory research, I had to sit and listen. I had to sit and revamp a lot of the questions, and also had to sit with the ways in which even I was someone that could potentially be causing them harm, even though I do want to implement positive structural change. Boy.
So I'll jump back in here. Just we're going to kind of start to close here with talking about collective strengths of CBPR that I think both of us sort of cited throughout talking about our case studies, as well as challenges, and then really ending with solutions. So ways that we've navigated some of the most persistent challenges that often result in CBPR research. So the strengths, again, we've highlighted lots of them, but it really is a process that enhances community relevance. So it really positions community at the center of our work and ensures that everything we're doing, whether it's data collection, intervention development, evaluation projects, that we are framing this work around the unique cultural context of a specific community unit, and that they are going to be projects that are mutually beneficial for the community. This process, one thing we didn't talk about, but that can be really beneficial when doing CBPR work, is that it can enhance the reliability and validity of measurement tools. So for example, we administer this big, it's called a Well-BQ. It's a big comprehensive well-being survey that's often administered in workplace environments. And it had never been implemented with the ECE workforce. And so before we landed on this as our evaluation tool, we worked with our steering committee and shared questions. And there were a handful of questions where the community was like, I don't even understand what you're asking. Like, that doesn't make sense for our context. So we had to make adaptations to the tool, and then, reran reliability and validity data to make sure that it was still a strong, reliable, and valid tool. But now it's culturally aligned with the specific community we're assessing. So that was a really valuable process to go through with our community members. This process increases engagement, as we've talked about, increases cultural sensitivity to ensure that the data and findings that we're putting out in the world, whether it's to community members, through papers, conferences, is culturally informed and sensitive to the community, and that we've collectively interpreted the results of these findings. So thus facilitating effective dissemination of these results. And then it really promotes trust, which is integral to doing this work and continuing to do this work and support communities. And then the flip side, so we go to the next slide, there's challenges. There are certainly challenges, as I think we both alluded to already, and we'll again talk about solutions in a moment. One of the biggest challenges that we both sort of landed on first, I think, was time. And given if you are in a faculty track or postdoc, whatever your situation is, you often don't have a lot of time to collect data, to implement something, evaluate something, and get it out in the world. So it's important to acknowledge that CBPR is not going to be appropriate for every type of study, for every type of funder. And we may need to think kind of creatively to use CBPR in this sort of time restricted environment. So we can talk about some strategies we've used to do that. There are sometimes threats to internal validity. So in doing CBPR, for example, with our well study, when we were first working with them to develop this study, it was right after COVID, and folks really, felt the strong need that mental health and well-being and isolation were key challenges in their community members or in their communities. And so we were not, of course, the only program to come in and work to support the mental health and well-being of this workforce. So there are some kind of competing priorities, competing programs that may impact the validity of our outcomes. And that's just, the nature of CBPR. Similarly, difficulties with randomization. So in doing this work, we, for example, randomized our centers, our 29 independent centers. We randomized over a 3-year stepped wedge design. And we had an agency director come to us and say, I don't want my centers to be in different cohort years. I want all my centers to participate together. So we had to modify our randomization, which is not ideal from a research perspective. But, we had to meet the needs and the requests of the community. So that can be a difficult tension. Interpretation challenges, you may have different, we're all coming from different lived experiences and backgrounds, so we may interpret findings differently. So that can sometimes be a point of contention. Acknowledging that everyone works differently. There's sometimes interpersonal conflicts and individual agendas. So again, the importance of aligning individual agendas and strategic plans as early as possible to make sure you sort of modify some of these potential issues early on. And then, as Kaleea alluded to, the tenure clock, again, this kind of gets at time, but you have kind of this finite window of opportunity before promotion or applying for promotion. So it's difficult when you're doing projects like this, can really take many, many years. And then we'll close on this slide, potential solutions and lessons learned. And I'll just kind of highlight, but then I think, we'll both kind of give examples through our research. So one of the first ones that we discussed is negotiation is key. And again, especially on the tenure track or if you're in a faculty position. And so oftentimes, depending on your university, depending on your department, CBPR may be seen as outside of or lesser than traditional research approaches. So for example, in my university, they sometimes see our CBPR work as practice-based work, not as research. So when I have to sell myself going up for promotion, as I am this year, I have to kind of integrate my CBPR work into my research bucket. And that can be a little bit difficult. So it requires good mentorship to really figure out how to do that. Kaleea, do you want to give an example of this?
Yeah, so really thinking about negotiation, particularly while on the tenure track. And so thinking about being in an institution in a red state, thinking through, and I'm not sure what's going on at other institutions, just the dismantling of affirmative action and DEI. So really thinking through, regardless of whether it's CBPR or any type of research, regardless of the method, it's health equity research. And so negotiation is key, particularly with thinking about how to think through how to communicate the purpose of your research, thinking through how to communicate the time, the importance of time, and how to really be that advocate for yourself as it relates to saying this is really time intensive, involved research. It is just as important as these other facets of research. And how do I particularly craft a narrative that illustrates the importance of health equity or CBPR based research as a way to really implement or show how structural change can go about within methods that are seen as not as rigorous.
And then the next kind of solution that we want to address is time and funding consideration. So we've learned this the hard way, our team. So we, in the beginning went after large federal and foundation grants and to do this work. And oftentimes there's pushback on, our formative research being a year was just, was not something that was fundable. They really wanted to see, jumping into implementation and evaluation quicker, having larger sample size, et cetera. So we kind of pivoted, and we now, for the Well project and for all of our other projects, we typically apply for small pilot grants first, either internal. I know at University of Colorado, where I work, there's lots of small pilot funding for early stage investigators. Even $10,000, $20,000 can be sufficient for formative work. There's also lots of local foundations that have small funding mechanisms that you can apply for CBPR work. And so we have done this now traditionally. We've gotten some smaller funds to do the formative work to really inform the development of what we're trying to do and integrate community feedback. And then we apply for the larger federal grants with you and use those data as preliminary data. So that process has worked well for us and helped us sort of navigate the sort of inherent tensions around CBPR research. Any additions?
Just to reiterate that community-based participatory research can be funded within small pilot grants or larger grants, and it is more so of how do we communicate again the purpose, the function, the importance of these methods.
Absolutely. And then I mentioned this, I don't know if Kaleea, if you have an example, but just being flexible with randomization and study designs. Of course, we go in this very rigid, structured study design that we're going to be doing to implement our program. And that's oftentimes with CBPR, pivoting is required. And so, you know, ideally your funder can be slightly flexible on that, and you can really figure out a way that's going to meet the community's needs and requests while also retaining the, you know, quality of the research that you're doing.
Yeah. So definitely thinking, for example, if this is a 2-year grant and you know we all come in with these really rigid timelines and we're going to get everything done on time as we specified within the grant, and then reality happens. And so how do you think through how to ask for example, a no-cost extension? How do you think through the fact that I was supposed to collect this data in February and I'm not starting until September? And so really thinking through flexibility and understanding that flexibility is key, and that does not mean that you have failed as a researcher.
And then the last 2 points we can kind of mold together, I think. So, you know, aligning outcomes with the strategic plans of a community. So I kind of gave an example, you know, as I talked about kind of how we pivoted from our early childhood focus to the teacher focus. So just ensuring that what you want to do is what the community also wants to do and needs. And then part of that is really cultivating, sustaining these healthy relationships. And just one quick example I'll give is, you know, the nature of our work is that funding comes and goes. And it's incredibly important to retain relationships regardless of funding. So even when we don't have funding to do work specifically related to early childhood well-being, we still are attending all the same community meetings we've been attending. There's 2 or 3 monthly meetings that the councils hold that we always attend regardless if we have funding for it or not. And that's, you know, obviously, again, back to the time constraint, that can be a challenge, but incredibly important to, if you're committed to doing this work long-term.
Definitely want to agree with that and have done the same thing.
So, well, I think that's all. Kaleea, do you want to, anything else that we missed, or should we wrap up and turn over to questions?
I don't think we left anything out, but I do welcome and look forward to the questions.
Me too. And thank you guys all so much for being here. I know it's a stressful week for many of us, so I appreciate seeing all of your faces.